Hi, everybody. I am so excited to talk to you today about breast cancer and how much control you have over this disease, whether it's already affected you or not. I hope that during our time together, you will feel empowered and incentivized to take control of the things in your life that are moving you closer to cancer rather than farther away. So let's launch straight in with a little view of the landscape of breast cancer. In 2020, breast cancer surpassed lung to become the #1 malignant tumor in the world, with about 2.3 million new cases worldwide last year. This year, even more expected next year, increasing every year until someone derails this bullet train. And you and I are going to be the someones. In our own backyard in the United States, almost 300,000 women will be diagnosed with invasive breast cancer this year. And looking at the prevalence of cancers, breast behind skin is #1. You're most likely to die from lung cancer, but breast is #2 with 43,250 deaths predicted this year. Remember, women are 26 times more likely to develop cardiovascular disease year after year, and 7 times more likely to die from heart disease than they are from breast cancer. However, over 2.5 million US women have died from breast cancer since 1970. So we have a lot of work to do. And I submit to you that it need not be so. Women have so much control over this disease. All right, so a few more quick facts for perspective. 4 million breast cancer thrivers are walking around alive and well, but they're probably fretting about recurrence. So I hope that today's discussion will be more empowering and take away some of that fret and anxiety. Men, you too can get breast cancer. About 2,800 men will be diagnosed with breast cancer this year, and 530 will die. Speaking of death, the death rate for breast cancer has gone down approximately 1.3% per year since 2011. That's thanks to earlier detection and better treatments. In fact, treatments are so good that the 5-year survival rate for node-negative cancer is now 99%. That never means that you die year 6. We like to use 5-year survival stats as doctors because this most accurately reflects the treatments that are going to be available to you when you're diagnosed, right? If I give you a 30-year survival rate, that may sound inappropriately low because that 30-year survival will reflect treatments that we were giving people 20 and 30 years ago, which may even predate Herceptin and other targeted drugs that are highly effective. Next fact, 95% of breast cancer occurs in women over 40. So despite all of us having heard of someone getting breast cancer at too young of an age, because it definitely happens all too often, the truth is 95% of all breast cancer and 97% of all breast cancer deaths occur in women who are over 40. In fact, the median age of breast cancer, meaning half at or above and half below, is 62 years old. Incidence, it's been on a really slow rise since 2004. In fact, if you look at 2010, the overall increase year after year is 0.4%, with this one little bloop in 2020 reflecting a lack of screening due to, as we all know, COVID. But this means this tiny, almost imperceptible, certainly to us just living our day-to-day lives, you're not going to feel a 0.4% increase, but you know what that translates to is 1,200 cases of invasive breast cancer added to our incidence year after year with no sign of stopping. I'm really grateful that out in the media, we're able to talk more freely and openly about breast cancer. It used to be such a taboo subject, right? But now we see celebrities and people we admire coming forward with their journeys, their stories, personal ones and family members. And I think that has created in part this awareness of maybe somebody's friend's cousin who got breast cancer at age 26 and sadly died from it. And it creates this false perception that the incidence is rising and it's happening younger and younger. And the stats bore that out because breast cancer had been rock stable in women under 50 for decades. Not so anymore. So hot off the press from late 2023, there was this study that looked at patterns in cancer incidence among young people defined as under 50 years old in the US from 2010 to 2019. So they took all the cancers, men and women, from 17 NIH SEER databases and found that there were just over 560,000, so over 500,000 people with early onset, defined as age under 50, early onset cancers. And guess what? The number one cancer was breast. So breast cancer was the most commonly diagnosed, but here's the alarming part. The age standardized incidence rates per 100,000 women in 2010, 21.25, in 2019, 23.74. So the annual percentage change is actually plus 0.91. Year after year, we're getting more and more breast cancer at younger and younger ages since 2010. I mean, if back in 1990 you had asked me to guess where we would be in 2024, for sure I would have thought there'd be less breast cancer, not more, right? Like, aren't we supposed to be smarter, bigger, taller, faster, stronger than we were 30 plus years ago? Apparently not. However, I believe we can reverse this disturbing trend together. I want to talk about a few risk factors that you cannot change, not to freak you out, but just to educate you. And then it incentivizes you, hopefully, to take more control of the things that you absolutely can change. So the number one risk factor for breast cancer over which you have Zippo control is being born female. So 1 in, pop quiz, 8 women gets breast cancer versus about 1.3 in 100,000 men. So for sure, being female vastly elevates risk over being male. But why would you do anything about that? Okay, so age. Aging elevates breast cancer risk. Nothing you can really do about that you want to do about it. It has nothing to do with how old you look. It's how old you biologically are. Maybe we can do some reversal of that biological aging through interventions. But one thing I like to point out is that 1 in 8 stat is not like every single morning when you wake up, you've got a 1.8 chance of getting breast cancer today. That 1 in 8 is pulled out over an entire lifetime, and it's stratified in this lovely slide by decade of life. So remember how old you are right now. And if your current age is between 20 and 30, the chances of getting breast cancer during this decade of your life, between 20 and 30, is 1 in 1,439. Far cry from 1 in 8, correct? So if you're 30 to 40, it's a 1 in 204 chance that you will get breast cancer during this decade of life. Between 40 and 50, 1 in 63. Between 50 and 60, 1 in 41. Between 60 and 70, 1 in 28. And 70 to 80, ding, 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 is your highest risk decade of life in which to get breast cancer. So there's a 4.1% chance that you will get breast cancer in your 70s, 1 in 24. And between did I say that right? Yeah. And then between 80 and 90, it's 1 in 33. So if you add up all those 1-ins, now you land at a lifetime risk of 1 in 8. And because these are rounded numbers, the actual lifetime risk percentage predicted just by being born female is 12.9%. All right, so we have being female, getting older, race. This depicts the incidence and mortality of breast cancer by race, incidence pink, mortality gray. You can see that whites and blacks have nearly the same incidence as each other up here, but relative to all other racial and ethnic groups, whites and blacks have at least 28% more breast cancer than all other ethnic groups. However, our African American sisters have 52% more death than other ethnic groups and 40% more than whites. So what's going on here is very multifactorial, and I have an entire 2-hour lecture on the nitty-gritty about ethnic disparities in breast cancer incidence and mortality. But the short version is that, as being multifactorial, it has both to do with things that are very correctable, like lack of access to quality, timely healthcare. Blacks are less likely to be insured and therefore less likely to participate in routine breast screening. Genetics and epigenetics are definitely at play here also. For example, African Americans are more likely to get cancer at younger ages and with a more aggressive tumor biology called triple negative. Approximately 22% of all cancers in Blacks are triple negative versus about 11% in most everyone else. Blacks are also more likely to be obese and have type 2 diabetes, which share underlying triggers for cancer that we'll explore a bit more in detail later. So it's a complicated scenario, but race is something you cannot change. Oh, and as much as you might wish to change your family, you can't change that either. And it's actually the family history that I'm interested in here. Why is this? What percentage of breast cancer can be attributed to an inherited genetic mutation, such as BRCA, CHEK2, PALB2? Is it, do you think 5 to 10% of breast cancer patients have a gene mutation that they got from their mom or their dad? So their family history is probably peppered with some breast, maybe ovarian, pancreatic, colon, uterine, other cancers. So 5 to 10%, 30 to 40%, 60 to 70%, 80 to 90%. Like, how strong of an association between just I have breast cancer and what's the likelihood that it came from a gene mutation? How strong is that association, do you think? 5 to 10%. Okay, so only 5 to 10% of all breast cancer can be attributed to an inherited genetic mutation, such as BRCA, CHEK2, or PALB2. This is very important because if you do have a gene mutation, you are at very elevated risk to get breast and potentially other cancers, for which we want to do some high-risk surveillance, some other potential interventions to reduce risk. So I'm not at all minimizing how important it is to find out and understand whether or not you have a genetic mutation. However, I want to emphasize the other percent then, which is 90 to 95%. 90 to 95% of all women with breast cancer cannot blame mom and dad, or maybe they can as we get into some of the other things we inherit that aren't genes. But the point is, the majority of breast cancer is not coming from a very strong underlying genetic mutation, a driver that you probably have very little control over manipulating because it's just how you are. Like, I cannot will my eyes to be a different color. So just for those out there who do have a family history, when does the red flag go up and you think, maybe I should actually test for that genetic mutation? Quick pause here just to say, if you feel like testing, you probably could, because what used to be prohibitively expensive, literally $4,500 just to test for one gene BRCA, has now become across the board $250 when not approved by insurance. So the cash pay is $250 for an entire genetic panel, RNA and DNA, and usually there are around 88 genes. There are panels of different numbers of genes that we test for, depending on what you want to do. But here are your red flags that really make me think, you know what, if you're in this category, it would behoove you tremendously to go and get gene tested. Here they are. You have to have 2 relatives on the same side of the family, meaning mom or dad. You are half your dad's DNA. Your dad's family history matters as much, equally so, as your mom's. Strange misconception out there. Okay, so you need 2 relatives on the same side of the family with breast cancer prior to age 50 or ovarian cancer at any age. Number 2, if you're Ashkenazi Jewish, you only need 1 relative with breast cancer prior to age 50 or ovarian cancer at any age. Really quickly, for those of you who are like, huh, what, why? Just by being Ashkenazi Jewish in descent, 1 in 40 people, men and women, carry a BRCA gene mutation, one of the founder mutations. as opposed to everybody else running around, which is 1 in about 500. So now we only ask for one relative to have these cancers to raise our red flag. Excuse me, if you yourself have had breast cancer prior to menopause, if you've had a subtype triple negative under the age of 60, if you have had 2 primaries, so not one that came back again in the same exact spot, but 2 totally different breast cancers, any men in the family tree, just one man with breast cancer raises the flag. Any known genetic mutation carrier with a direct bloodline to you obviously elevates your risk. Speaking of which, so if your mother has a known gene mutation, it's not a fait accompli that you got that mutation. It's always 50-50 that you get it from an affected parent. If there's pancreatic cancer plus 1 ovarian or breast, and if there's just a whole lot of cancer going on, so 3 or more of the following: breast, ovarian, pancreatic, prostate, colorectal, gastric, uterine, or melanoma. So if you can already see that you meet these testing criteria, I encourage you to meet with a genetics expert or just your family doctor to inquire about testing. All right, so